Today's a big day. Today is World Autism Awareness Day, and we're sharing more about what parents need to know.
And joining us now, our 9 health expert, Dr. Pyle Coley. We hear this a lot, that the number of autism diagnoses, that number is going up. Is it going up?
And in fact, it actually is going up, but I'm going to tell you that that's actually a good thing because we're looking harder for the condition because we know the earlier that we diagnose it, the better.
Right.
We've also changed the criteria for diagnosis of the autism spectrum disorder. That's intentional because you'd rather pick up somebody on the spectrum, intervene early so that you can change the prognosis. So we've made the criteria more sensitive, sort of easier to get an autism spectrum.
Have we broadened the spectrum, so to speak? Because I think it used to be something that maybe people would recognize unless it was severe.
We have broadened it, Tom, and that's, like I said, intentional because a lot of child neurologists and behavioral psychologists have looked at this and said a lot of times we don't pick up these individuals until they become adolescents or adults, and that's a miss. So if we make the criteria more sensitive, we're more likely to screen in kids, and we're looking a little bit harder because there's more awareness. There's days like today to help raise awareness. Now there's also some talk about potentially more exposure to environmental and genetic factors that could increase risk as well of autism.
And when you bring that up, there's been so much misinformation over the years. Now, what do we know? What are the possible causes of autism?
So it's hard because it's multifactorial and there's not one specific cause, but certainly genetics plays a role. So if you have a sibling with autism or family member, you're more likely to have it. Certain chromosomal abnormalities as well. And the other factor that's emerged that we're seeing a lot more now is having older parents. So because of all the advances in fertility and reproductive medicine, people are having kids a lot later, and that potentially could be a contributing factor as well. But it's really complex because environment can have a huge role in how the autism is expressed. So even if you have a tendency for autism, your environment can help to sort of bring it out more or less.
So I just think that we all know people and families that are dealing with autism, and you see the breadth of that spectrum from kids who can barely communicate with the outside world, and others who are almost, you wouldn't even know they were on the spectrum if you weren't told. So when you talk about treatment, that has to be probably as broad as the spectrum itself.
The treatment has to be broad and it has to be personalized. And that's the key here because autism spectrum disorder looks different for every child or every adult that's struggling with it. And you could have more or less of the differing components of it. So there's obviously the social communication, how you read other people's facial expressions, how your language is. That's a huge part of it. There's the behaviors, the repetitive behaviors, the kind of, the patterns that you like to do. There's even some physiologic things like sensitivity to sound that could be turned up or less, as sensitivity to moving lights, those types of things. So which components you have really will look different, and the treatment really has to be tailored to what your autism looks like.
Are those treatments all person to person? I mean, we're not talking about drug treatments. We're not talking about other methods of treatment. It's really person to person communication and development.
It really is, because we're thinking this is largely a sort of social and communication disorder, less physiologic components to it. And so the treatments are geared at sort of speech therapists and language therapy. They're geared at emotional maturity and communication. They're geared at psychological counseling, all the things that we want to help people to sort of normalize with, but also to recognize that our treatments are not going to fix everything. And there's still a lot that parents and family members and caregivers have to actually learn how to recognize and learn how to do for people that live with autism.
Well, the awareness has certainly gone way up, and as well as the treatments and the people. There's so many great methods out there now, so it's kind of exciting. It's more to come.
It's really, really exciting, and I really want to empower all parents out there to keep their radar up, because you can start to diagnose autism as early as 18 months, and by 2 years, you can almost certainly have a valid diagnosis. Now, it's a multiple team of people that evaluate your child, but if you think your child might be on the spectrum based on these types of behaviors, get them assessed early, because the earlier we do these interventions, really the less impact it's going to have on their life and the higher functioning they're going to be.
Well, it's World Autism Awareness Day. We're glad you helped make us aware about some of that today. Thanks as always, Dr. Pyle Coley.
And don't forget, you can find more health news with Dr. Coley at 9news.com/Dr. Coley.